Welcome back to Skin Honestly. I'm Dr. Low Chai Ling, aesthetic physician and your guide through everything you wish someone had explained earlier. Today we're talking about fillers, and I know what you're thinking.
Celebrity faces. You're thinking celebrity faces.
Everyone is always thinking celebrity faces.
I mean, there are some very obvious examples out there.
There are. And we're going to talk about exactly why that happens, but we're also going to talk about when fillers are genuinely wonderful. Because they can be. When done right, fillers are one of the most satisfying treatments in aesthetics. When done wrong, you end up looking like you're storing acorns.
Did you just say acorns?
I've used that analogy in clinic. It lands every time.
So, Dr. Low, what actually is a filler? Like, what are we putting into the face?
The most common fillers, and the ones I use, are made of hyaluronic acid, which sounds very scientific, but is actually a substance your body already makes. It's naturally present in your skin, your joints, your eyes. It holds water, it creates volume.
So it's not synthetic?
Hyaluronic acid itself is not synthetic, but the filler product is a lab-manufactured version that's been cross-linked to last longer than the natural form. It's been used in aesthetics for about 20 years, extensively studied, very safe track record.
How long does it last?
Depends on where it's placed and how your body processes it. Generally 6 months to 2 years. Areas with more movement, like lips, tend to break it down faster. Areas with less movement, like under the eyes or the jawline, can last longer.
And the body just absorbs it?
Yes, that's one of the things I love about hyaluronic acid fillers. Specifically, they're reversible. If something doesn't look right, there's an enzyme called hyaluronidase that dissolves them. You're not stuck with a result you hate.
So, where do fillers actually work? Like, what are the best uses?
The classics are lips, cheeks, under-eye hollows, jawline, and chin. These are areas where we lose volume as we age. And restoring that volume gives a genuinely youthful, refreshed look without anyone being able to put their finger on why you look better. They just think you've been sleeping well.
That's the goal, right? No one knows.
Exactly. The best aesthetic work is invisible. Nobody should be able to tell. They should just think. You look well, you look rested. There's something different about you.
I've had filler in my cheeks, actually. And that's exactly what happened. My mom thought I'd started a new skincare routine.
Wait, you've had fillers?
I have. And it was completely unremarkable. In the best way. I went in, it took about 20 minutes, there was a little bruising for a few days, and then I just looked better.
That's the ideal outcome. You feel a little more like yourself, a little less tired, nothing dramatic, nothing obvious.
So when does it go wrong? Because we've all seen it go very wrong.
It goes wrong in a few ways. The most common and most visible is overfilling. Too much product placed in the wrong areas over too many sessions without letting the previous filler settle or dissolve first. The face starts to look puffy, round, unnatural. That's the pillow face.
Why does it happen? Is it the patient asking for more or the doctor?
Both. Sometimes patients have a distorted perception. They've looked at themselves so long that normal starts to look wrong and they want more. We call it aesthetic drift. And if the doctor keeps saying yes, you end up somewhere no one intended.
Shouldn't the doctor just refuse?
Yes, and a good doctor will. Part of my job is managing expectations and sometimes saying, no, you don't need more. What you need is a rest, or in some cases, to dissolve what's already there and start fresh.
Have you had patients come to you with filler that needed to be dissolved?
Many times. It's actually one of the more common things I see. Someone who's been somewhere else, accumulated too much product over the years, and now they want it fixed. Dissolving and resetting can completely transform how someone looks. And they're always relieved they did it.
That sounds scary though. dissolving something in your face.
It's very straightforward. The enzyme works within minutes. There's some swelling initially as everything breaks down, but within a few days the skin settles and you see the true baseline. From there, you can make a fresh, considered plan.
Are there areas where fillers are riskier than others?
Yes, and this is really important. The nose and the area around the eyes are higher risk zones. Not because fillers don't work there, they can be beautiful, but because there are blood vessels in those areas. And if filler inadvertently enters a vessel, it can cause a vascular occlusion, which is a medical emergency.
That sounds very serious.
It can be. It's rare, but it's not zero risk, which is exactly why fillers should only be done by trained medical professionals who know the anatomy, know the warning signs, and know how to manage a complication immediately. This is not a treatment for a beauty salon.
What are the warning signs someone should look out for after a treatment?
Immediately after or in the hours following. If you notice skin turning white or a bluish-gray color, or you feel unusual pain, that needs to be addressed urgently. A good clinic will have you call them directly, not post on social media. Call?
And if you went to a bad clinic,
Then hopefully you have hyaluronidase on hand and someone who knows how to use it, which frankly, not all beauty salons do. That's the risk.
Can we talk about lips specifically? Because I feel like lip filler has this huge range, from beautiful and natural to very obvious.
Lips are one of the most requested areas and also one of the most frequently overdone. The lips have very specific natural proportions. The upper lip should generally be slightly smaller than the lower lip. When people go too big, especially too big on the upper lip, it looks unnatural immediately.
the duck lip.
The duck lip, which nobody actually wants when they walk in. But it happens when there's too much product placed incorrectly without respecting the natural border.
Is there a safer approach for lips?
Start small, always. You can always add more at a later appointment. You cannot undo overnight. A good practitioner will undertreat on the first session and review in 2 weeks. That's the conservative approach, and it's the right one.
You keep saying less is more. Is that a real principle or just something doctors say?
It's absolutely a real principle, and it comes from understanding what actually makes a face look young. A youthful face isn't a face with huge lips and apple cheeks. It's a face that has good structure, good skin, and a well-rested look. That's achieved through subtle strategic treatment, not through filling every line and adding volume everywhere. The analogy I use, a good aesthetic result, is like a good tailor. You don't notice the suit was altered. You just think the person looks great in it.
I love that.
Okay, I'll admit that actually makes sense.
Progress.
If someone's considering fillers for the first time, what should they ask?
3 things. 1. What product are you using and why? There are many filler brands, different densities and consistencies for different areas. Your doctor should be able to explain the choice. 2. What is the plan if I don't like the result? The answer should involve hyaluronidase being available. 3. Can I see examples of your work? Subtle, natural-looking results, not before and afters where the transformation is so dramatic it could be a different person.
And red flags?
If a doctor shows you before and afters where everyone looks dramatically different, big lips, huge cheeks, that tells you about their aesthetic sensibility. Run.
Diplomatically put.
I've been doing this long enough to be diplomatic and honest at the same time.
This was genuinely so useful. I feel like I understand why things go wrong now. It's not just bad fillers. It's bad decisions. Too much. Too fast. Wrong hands.
That's exactly it. The filler itself is usually fine. It's the judgment around it that matters, and finding a doctor who is willing to say no, who has your long-term face in mind, not just the next appointment. That's everything.
I have to say, I came in thinking fillers were purely vanity, and I still think they can be misused in that direction. But I understand now that in the right context, done well, it's actually medicine.
It is medicine, aesthetic medicine, and it deserves to be treated with the same rigor as anything else a doctor does.
Ryan, are you going to admit you'd consider it?
I'm going to say, I'd consider a consultation. That's as far as I'll go today.
I'll take it. Thank you both. And thank you for listening to Skin. Honestly, next time we're talking sunscreen. And yes, you're probably doing it wrong. See you in 2 weeks.